All right. Hi, everyone. Welcome back to another Facebook Live. I'm Caitlin Engel, a registered dietitian and the Program Development Director here at NKF. I'm so pleased to be joined today by Dr. Joseph Vassalotti and Dr. Holly Kramer. Dr. Vassalotti is our Chief Medical Officer here at the National Kidney Foundation, and he's also a clinical professor of nephrology at the Eichen School of Medicine at Mount Sinai. And Dr. Holly Kramer is the president of the National Kidney Foundation and an associate professor of public health sciences and medicine at Loyola University in Chicago. Thank you both for joining us today as we start to begin this discussion about the new normal we're living in as parts of our country do begin to reopen.
Yeah, thanks for having me. I first wanted to just because of our audience, I would ask you to sign a petition that the National Kidney Foundation launched last week. And you can find that petition if you just Google National Kidney Foundation petition, or you can find it on Facebook and on Twitter. And the petition is really asking public health officials and healthcare providers to prioritize the needs of patients with kidney disease during this COVID-19 epidemic. As states start to reopen, we're really concerned about what's going to happen with our patients. So there's 6 items that the petition is really urging public health officials and healthcare providers to prioritize for our patients. So the first thing would be to make sure that our patients and the healthcare providers who take care of them have adequate personnel protective equipment like face masks and gloves to make sure that we're not spreading the COVID-19 virus to each other and then bringing it back home or giving it to other patients who are on dialysis. And the second thing is to prioritize patients with kidney disease and their healthcare providers for COVID-19 testing, and then to do contact tracing to try to reduce the epidemic among our patient population. And the third thing is to ensure access to surgeries that might have been delayed. I know I had many patients who needed vascular access surgery back in March, and I'm in Chicago, and some of those surgeries are still being delayed now because we're still in stay-at-home orders under Governor Pritzker until the end of May. So we're really trying to prioritize those surgeries that might have been delayed that our patients really need to make sure that they have adequate access for dialysis or other types of needed surgeries that might have been delayed. So really prioritize that as surgeries start to become open again for elective procedures. The next thing is to make sure that we have 90-day supply of immunosuppressant medications for patients who have a kidney transplant, so they're not having to go back and forth every single month to get their medications. And then the fifth thing is to make sure that we have safe transportation for patients. So I know that many patients who might take the bus or Medicare car, a lot of times if they have COVID-19, sometimes they're being refused transportation. And that's a real concern for us. And we want to try to make sure that people have the transportation. And then the last thing, which I know Dr. Vassalotti is going to talk about, has to do with the safe reopening of kidney transplantation. So I know nationwide, kidney transplantation is really kind of, really slowed down its pace. So last week, there were about 300 cadaver kidney transplants that were done nationwide, but only 20 living kidney donations for kidney transplant recipients were done last week, which is just, a really, really low number. So we have to figure out how can we really make living kidney donations safe again and try to resume kidney transplants to help get our patients off dialysis. So that's some of the things I really would hope that our listeners would look for that petition to try to capture the attention of public health officials that we are a strong advocacy group. Our voice matters. We have about 1,000 people who have signed the petition to date. So I ask you to try to find that petition, sign it, get your family members to sign it so that we can really have a strong voice and make sure that the needs of our patient population are met. So we are going to talk about how do we safely reopen states as we move forward in time during this COVID-19 pandemic. Just want to give you my perspective that I'm in the Chicagoland area. Loyola is about 30 miles directly west of Lake Michigan off of Highway 290, the Eisenhower Expressway. And all the way out, we were considered to be the western suburbs, and all the way into the very inner part of Chicago. We're still seeing an increase in the number of cases of COVID-19 and hospitalizations and death. Governor Pritzker renewed our stay-at-home order until the end of May. But right next door to us is Indiana. I mean, I literally can take a 30-minute drive, and I'm in another state, Indiana, that is reopening. And there's a lot of traffic between our two states. A lot of people live in Indiana and work in Chicago, and vice versa. And so Indiana is actually going to be reopening this coming weekend. And I've seen ads for restaurants where they're going to resume, in restaurant service, albeit with a lower number of people in the restaurant. So we're seeing spotty reopening and other places staying closed, like here in Chicago. How does that affect our patients, and what should we be thinking about social distancing and protecting ourselves for people who have chronic kidney disease? And the short answer is that we still need social distancing for patients with kidney disease. We can't just assume that this epidemic has gone away, despite the fact that people are now getting their hair done and their nails done and going to restaurants again. The risk is still there for our patients who've had a kidney transplant or they're receiving dialysis. So we still have to be really, really cautious and maintain social distancing. And I just read an article this morning about how in New York City, they did a survey of the hospitalized patients, and they found that 66% of the hospitalized patients in New York had not left their home. They had really done social, not done any going outside of their home. They were doing social distancing. They were doing what they were supposed to do, yet they still got the infection, probably because people were coming to them, maybe people visiting them, or people that maybe you might have been having conversations with in the grocery store when you had your rare out time outside the house, that they were getting infected. So I think it just shows that we really need to be cautious, really need to be careful about who we come in contact with, especially young people who might carry the virus and not have symptoms. So the short answer is that patients with kidney disease need to maintain social distancing in order to protect themselves from the COVID-19 infection. So I just want to ask Dr. Vassalotti, how do you feel dialysis care is going to change as states start to reopen for business?
Well, thank you. So it's really great to do this together, and I think this is going to be really engaging. So pleased to be here with everyone. I want to point out that this is May 7th, 2020. So the things we say apply to May 7th, and I think our country will change as time marches on, and some of these things that we say today might be different in the future. I think it's really important that what we do for dialysis patients, we want to, of course, always refer you back to your dialysis care team. So that's where you should get your source of information. It's your dialysis care team. And what we're doing here is just to really supplement that, really give you some background and maybe help you navigate your care with your dialysis care team. The most important thing I think I could say is that you need to continue dialysis treatments, whether you're in-center hemodialysis or whether you're at home with hemodialysis or home with peritoneal dialysis. Continuing your treatments at this time is so important to help keep you healthy, to help avoid the need for hospitalization. I think that with dialysis care, the issues of testing will probably be important. I think that we should prioritize our dialysis care population in terms of testing. And there are two kinds of tests that are being offered now. One of them is the swab, and that's kind of like a long Q-tip that goes into your nose, into the what we call the nasopharynx. And that's really to test if you're sick and if you have some of the symptoms, and if you have, you may have the virus infection. That's probably going to be done in an acute setting or an emergency room or urgent care or some place where your dialysis care team recommends you to go. We don't really know the second test. That is a blood test. So that's a venipuncture, and that's going to be an antibody test We don't understand what that test means, but in general, that's being worked out now by the CDC and others. And the antibody, if you have it, may mean that you had previous infection. So that's one thing it can be used. And the other thing it can be used for is to determine if you have immunity to the virus or you're protected from future infections. Now, we haven't worked that out. So it's if you have the antibodies or not. Antibodies are things that we have in our bloodstream that protect us from infection. If we have that, that may be something that protects us in the future, but we have to work that out. And the level of the antibody that's in that blood specimen needs to be determined. But these are things I think that are going to become important for the dialysis care team as time marches on and as the tests availability improves at your local level. So sometimes the tests might not be available where you're living right now, but in the future they may be. And also the validity of the testing and the meaning of what the antibody test result means or not. I think we could have pretty similar conversations about other kinds of care, but I would say a little bit more about the dialysis care team in terms of telehealth is something you want to work with your doctors with, especially if you're on home dialysis. Even if you're on in-center dialysis, telehealth may be used. So to prevent face-to-face visits, laboratory values, maybe you may have that blood test that I mentioned may be done in your home, or maybe you'll go to a clinic and try to have a scheduled time where you can have that test done. So you limit your exposure. And I think Dr. Kramer mentioned a 90-day supply of immunosuppressive medications, but I think you should be asking for everything that you get, whether it's for high blood pressure, diabetes, or for a phosphorus binder, whatever medication you're taking. And the average dialysis patient takes multiple medications. You're going to want to ask your care team if you can have that ordered by 90-day supply, if you can have that a mail order so you don't have to go to save you a trip to the pharmacy. All those are things to think about as you move forward. And then, it's been difficult. I've been doing a lot of televisits and I've done a little bit of inpatient care lately. It's challenging for people. There's a lot of fear out there, and which is totally understandable. But I'm worried that people are staying home with illnesses that they would normally go to their emergency room to, or to at least seek care. So if I don't wish this on anyone, but if you have chest pain, or if you think you might have a stroke, you have weakness on one side of your body, tingling, that is something that really needs to be addressed. And it seems that what the data that we're seeing from other countries and from cities in the United States is that people are staying home with those conditions. And especially now as we open up, that fear should be still there, still concerning, and still we want to be cautious. But if you have an acute illness, we need to seek care. And I think the last thing I'm going to say is that there's a lot of misinformation out there, and it's very confusing even for us. So I know it must be confusing for you. So please work with your care team. That's the most important thing. Work with trusted sources of information. The CDC, the Centers for Disease Control, they have a website, cdc.gov. That's trustworthy. Your state health department is trustworthy. New York City, we have a city health department. Chicago has a city health department where Dr. Kramer is. That's going to be a trustworthy source if you live in a large city. And of course, the National Kidney Foundation website is a trustworthy source, and try to use those sources to help guide you to move forward, and be a little bit careful about all the different information that you're hearing. Unfortunately, we don't really have a national plan. We don't have a CDC plan for opening up. And I think it's worth mentioning that so that a lot of this information may be clarified and I hope we'll have guidance from the CDC soon, that will help us move forward to understand at least what a basic plan and what the phases will look like. So I think I'll stop there, and it's really great to be here with you today. And I want to lastly thank everyone for staying at home, for paying attention. We've made a huge difference here in the New York City area. The things were terrible in the first 2 weeks I would say, of April, and now they're really starting to improve significantly. We're definitely still not opening up in this area, and I wouldn't say that the risk is reduced to the amount that I'd like to see it reduced to, but we're certainly going in the right direction. We're looking forward to to moving forward.
Thank you both for sharing all of that. And I know that you have some other points you want to get to, but I just want to let everyone watching both on Facebook and on the webinar remind everybody to submit your questions in the comment box or in the Q&A box, depending on where you're watching. We will get to those questions. We'll do our best to answer as many as we can here live. So keep submitting them, and we're going to get to them very shortly. Dr. Vassalotti, do you want to talk a little bit about maybe some of the implications for transplant patients or potential transplant patients, those transplant surgeries with reopening, or kind of what that looks like right now?
Okay, so I think the most important thing to say is, just like I said about the dialysis care team, the transplant care team. So of course you have to work with your transplant center and your transplant care team, and they can give you individualized information. But in general, I think that if you already have a kidney transplant, some of the same things I said apply. You know, of course, take your medications, try to get a 90-day supply, work on telehealth. As far as transplant opening up, so if you're a candidate for a transplant and you're a living donor transplant, or you're on the deceased donor kidney transplant list in the United States, you're gonna have to work with your local transplant center in terms of, you know, when can your living donor transplant be scheduled? You know, what are the things to think about? What's the local risk? You know, what are the practices there? What is your risk of not getting a transplant now as an individual? Are you struggling with dialysis? So maybe that would push you to really try to get a transplant sooner than later. Are you a chronic kidney disease patient who has low levels of kidney function but aren't on dialysis yet? And maybe you have some time, and maybe you can wait until the outbreak in your area quells. So I think all those are things that should be taken into account by you and your transplant care team. Of course, I think all the transplant societies recommend testing of donors for COVID-19, and probably the recipients too should be tested. So there may be testing that you have to undergo, and how that works, what type of test you're going to get, how it's interpreted, how many tests you're going to need, all of that needs to be worked out with your transplant center. And I think that this is a time where you should be especially careful if you're a transplant center, because you take immunosuppression. And if you get COVID-19, you can get through it, you can survive, and we should hope that you will, but you really want to try not to go down that path. And you really want to do all the things that Dr. Kramer mentioned in the beginning, to do the social distancing for 6 feet, to wear masks when you go outside, to wash your hands, especially when you return, try not to touch your eyes, your nose, your mouth. So I think those are some of the important issues that come up for kidney transplant recipients and potential kidney transplant recipients. And we've gotten a lot of questions from kidney transplant donors. So I think I would just say that if you're not sure, just assume you're at increased risk. And you know, it depends also, do you have the other risk conditions that we know for COVID-19? Like, are you 65 or older? Do you have diabetes or hypertension? Do you have lung disease? Do you have cancer? Are you taking immunosuppressive medicine for a cancer? So those are all the sorts of cardiovascular disease, I should mention too. So those are the sorts of things that I think come into play in terms of prior living kidney donors.
Thank you, Dr. Vassalotti. Dr. Kramer, would you want to, I mean, I know we've talked about staying home and we've talked at length in previous events about the signs and symptoms of COVID-19, but do you want to just remind everyone? I think that's an important thing, especially as we've learned new information over the last few weeks. Remind us what those signs and symptoms are.
Yeah, sure. So actually recently the CDC changed the signs and symptoms. Before they had really kind of emphasized fever and cough, but now we know that many people may not necessarily have a fever. You may just have chills, and chills might actually be one of the first symptoms that you notice, is just like shaking chills, can't get warm. Muscle aches is another one that's kind of unique. So you can kind of differentiate you know, allergies, which now, you know, like where I am, allergies is a big thing. So allergies is not going to be associated with chills. Allergies will not cause muscle aches. So that's something new. The cough that you would have with COVID-19 is generally a dry cough. Usually not associated with sputum. People can feel short of breath, especially with exertion. You may not necessarily feel short of breath at rest. It may be just like if you take a shower or something like that, like your normal day-to-day activities, you notice yourself getting short of breath, that might make you think that something is wrong. Some people also might have gastrointestinal complaints like diarrhea. I've seen many patients that have had presentations with fever and diarrhea, but probably the most common one would be like fever, cough, is generally how people are presenting to the emergency room. But just remember that you can also just have chills and not have a fever. So it'd be, and I don't know if Joe, you want to add to any of those symptoms?
I think you did a great job. I think you covered most of everything that I've heard about. The only thing I think occasionally headache, and I think it seems like early infection could be a new loss of smell and loss of taste. So that's a new, you know, some people have loss of smell that they've had for 10 years. So that is not a symptom of this. But if you have new onset loss of taste and smell, that would be something to think about. And that might be an early sign. But I saw an article from Brooke Baldwin, who's a CNN writer, and she said that everything smelled like jewelry cleaner. Like, wow.
That was like the first thing she noticed. Yeah. So
I don't know what jewelry cleaner smells like, but it doesn't sound like it's a pleasant thing. I would say that I think that the presentations are pretty varied in general. So some patients might have just one of those symptoms, or some patients seem to have more diarrhea. Maybe that's more immunosuppressed patients. And some of the patients who are early and maybe doing well have the loss of taste and smell. So it seems like a lot of variety in the presentation. And I think immunosuppressed patients, particularly if they take steroids, they might not have the fever. But you know that. I think if you're not sure, it's really important to, especially now that we have more testing, speak with your care team and decide, you know, what kind of test and when.
Right. I know that here in Illinois, our governor has really been trying to test a lot more people. We're one of the states that has the highest number of testing, which is the reason also that we have more cases than other states, because we are doing more testing. You can go to any of the public health testing sites, and takes about 2.5 hours if you get there by about 10 a.m. Maybe it take a little bit less if you get there by 8 a.m. If you get there by noon, you may not be able to get testing, but I would generally recommend, if you're going to any of these public testing sites, to not drink any coffee or anything before you get there, because just plan on that you'll be in your car for several hours before you get the test. So just, you know, keep that in mind. But it is available, at least in Illinois. I don't know what kind of testing sites they have in New York, but I know like in Illinois, you can just Google the Illinois Department of Public Health, and then it'll give you the list of the testing sites, and they're located across the state of Illinois.
Yeah, those are really good tips. And I think in general, for most states, contacting your state health department is probably going to be the best way to find out where you can get tested. Well, before we jump into audience questions, I know we have a lot coming in. Do you guys have anything more that you wanted to cover or add?
So I just want to again reiterate that petition, you know, just Google NKF petition or find it on Facebook or Twitter. I know that Joe and I have tweeted that petition out, that we need your signatures, get your family members to sign on. Circulate this, that the more power we have with that, the more we can really start bugging public health officials to prioritize the needs of patients with kidney disease.
Yeah, I guess. Yeah, thank you. I think that would be great if you would sign that petition. And I just want to thank the healthcare workers, your dialysis nurses, your transplant care team. I want to thank all the clinicians that I've worked with, the nurses of, you know, dialysis nurses have done so much in this time. I have to say, so many of them have become sick in the work that they've done, and you know, we're so grateful for the care that you give and the difference you make for our patients every day. I'm so grateful for the ICU doctors and the nephrologists and the ER doctors all across America. I just want to say how, you know, how proud we are of, you know, under really difficult circumstances, you know, we're doing the best that we can for our communities and for our patients.
Thank you for saying that. That's really well spoken. So I'm going to get right into the questions. So on Facebook, Vicky is asking a question that I think a lot of people are probably wondering. So she says that so her company is considered essential and she's been working from home for the past several weeks. But her company is looking at bringing people back into work soon. And she's wondering if necessary, are transplant patients covered under ADA protection, job protections to be able to continue to work from home? Like, what are her options to not have to be forced back to work?
I can say that, you know, this is unprecedented time. So it's not like you can look at case law and say that this applies. So I would, if I were her, if you don't feel comfortable going back to work, contact your physician and ask them to write you a letter. And I have already done that for patients. And I've even done that for patients' family members who are living with a patient because they're concerned about them getting COVID-19 and bringing it in. So I think reach out to your provider and advocate for yourself.
Thank you. So another question that I think we're getting from a lot of people is just, what is the safety for either dialysis patients or transplant patients about socializing, having friends over, going for car rides with friends, going to friends' houses? What are your recommendations with that right
Joe? I think you're on mute.
now? You're muted. Technical difficulties.
So is that better?
Yes.
So I think that you have to take this individually. I think, you know, this sort of reminds me, my wife and I have 2 teenagers now, but when they were young, we would visit family, maybe have an hour, 2-hour drive, and we would get the question from the back seat, you know, are we there yet? You know, are we there yet? You know, are we there yet? You know, and I would say 5 minutes closer than when you last asked me. So it's kind of like that. That's kind of how I would approach that question. I really be careful. You know, the risk for you is going to be higher because you're a kidney transplant recipient or you're a dialysis patient. And you really, you know, I know that it's hard to be home, but really be careful about those kinds of interactions. You're still you can still have some, I know people are having dinner parties through Zoom or Skype or one of these other, you know, formats or FaceTime or whatever whatever format you're comfortable with. If you want to meet face to face, you know, you probably want to still keep the 6 feet of difference. You want to still wash your hands. You want to wear a mask. If you're going to go out, if they're going to come to you, you still want to make all those kinds of protections and precautions. And you really, you know, you really want to make sure you're not going to interact with a sick person. So of course, if that person has symptoms that could be some of the symptoms that Dr. Kramer and I reviewed earlier, you know, you really don't want to get involved in that, even if they've had those symptoms within the last 2 weeks too. So I think you have to ask some hard questions about, you know, are you feeling good? Do you think you could be sick? And you want to go through all that. And you know, you want to make these kind of things, try to limit them as we gradually open up. And and some of this will depend on where you're living. You know, this is going to be much harder if you're in a state that's opened up than if you're in New York City right now. So I think, and you're going to be asked more probably to do these kinds of things if you're in a place that's opened up more. So, you know, as we move on and we understand things better, and maybe we have more testing and we have the antibody testing and other things that you know, maybe this answer will change, but I think that's what I would say right now.
Thank you. So David on the webinar asks, and maybe Holly, you want to take this one. His wife returned to work. She works at a court, and her coworkers are not wearing their masks but are keeping their distance. Is he more at risk because his wife is going to work and maybe the coworkers are not taking on all those protections?
Yeah, I would say yes, that is a risk. That's a problem. I don't know if his wife can adjust what she does, if she could, try to stay 6 feet away from everyone. I mean, her wearing a mask really protects other people. She wants everybody she works with to wear a mask so she doesn't get it and bring it home to her husband. So I think what would be best is if she just tries to do social distancing at work and really try to stay away from people, especially anyone who is coughing, for sure. Really stay away from those people and maybe not go into work if she knows there's someone who has any kind of cold symptoms at work.
Yes.
But that's a tough situation.
Yeah, that is really hard.
Yeah, I would say one other thing is that it seems that some people can get this virus and not have symptoms at all. We didn't mention on the beginning. So that really would worry me that, really, I think all the things Dr. Kramer said are so important for that reason, because she may unknowingly return and expose the others to the virus in that way. So
yeah, that's a really good point.
And people also, it seems that the virus may be transmissible, or you may be able to spread the virus to others before you have symptoms. So if you get sick on tomorrow, you might express the virus today, and that infect others today, for example. So I think that those are reasons to be extra cautious.
Yeah, all the more reason to stay home as much as possible. So we have some questions on Facebook too. Sorry, I'm just looking at our Facebook feed. Lots of good stuff coming in. So Barbara on Facebook is asking, so she's post-transplant and has been home from work since March, but she works at a center for adults with cognitive and physical disabilities, and where it's a little bit harder for them to follow social distancing. So she's wondering what advice you might have about when she should return to work and what kind of safety measures might be able to help her.
So I assume that these people are not institutionalized, that they're like at home and then she works with them, I'm assuming.
Yeah.
I know, like in Chicago, we've had issues of places where people with developmental disabilities where they're institutionalized, that we've had outbreaks, and that's been really awful. But I think if they're just coming from home and she's working with them, I think that's really problematic. I've done work like that myself when I was much younger, and I know that you really can't social distance with that. So I think that's really problematic, and she might want to talk with her employer about maybe trying to do something different. I don't know if you have any other recommendations, Joe.
Yeah, I think I agree with everything you said, and I think is there other ways you can work. I feel my heart goes out to you because our employment is so important to our sense of contribution to society, to our financial wherewithal. It's our connection to our health insurance often. So, I know it's a struggle, but I think you have to try to negotiate this as best as you can. We want you to keep your job and be financially sound, come through this financially whole, but at the same time, we want you to do it in a way that's safe.
Yeah, it's a lot of tough questions for a lot of people to have to make decisions on. So one of the attendees in the webinar asks, so her husband is on dialysis and immunosuppressed. Should she and her husband continue wearing masks until a vaccine is found and continue social distancing?
I think you should wear a mask anytime you're out. I think, like, if you're inside the home, I don't think that you need to wear a mask, but anytime you're out and going to be, at the grocery store, the post office, anything like that, I think both of you should wear a mask, and then you're protecting other people. But, just the fact that if everyone's wearing a mask, then we all feel comfortable doing it, and there's no social stigma with it. So that's one reason that we should all wear a mask. You know, I was in China a couple of years ago and everyone wore a mask just because of the pollution. So when the epidemic came, it was no big deal for them. They were already wearing masks, and that probably helped to quell the pandemic. So, you know, I see how, you know, Americans like to be individuals, but in this situation, if all wear a mask, it helps all of us. So I would say definitely wear a mask, definitely, until maybe even after we have a vaccine. Who knows how that's going to go, but that's my 2 cents on that.
Great. So another good question that I've heard this from other people in the past is that people who are on immunosuppressive meds, might it actually help them if they get coronavirus because they don't go into that extreme, I think it's called a cytokine storm, when you sort of, your body goes into overdrive and trying to fight the infection. Is there any truth to that? Any evidence to support that?
I'll try that. So I think, you know, we need to understand this better, and we need to understand why certain patients do very poorly with this and others seem to do better. I guess it's fair to say that that's a possibility, but I wouldn't use that as a reason to feel like you're protected. Of course, it really depends. If you're early in kidney transplant, you're going to be on intense immunosuppression. If you're 5, 10, 20 years out of your kidney transplant, you're probably on much less. But even the patients who are far out from their transplant seem to have very poor outcomes from individuals in New York City, at least in some studies that we've seen from local experiences from hospitals in New York City. So that the severity of the virus seems to be much worse in patients with COVID-19. Unfortunately, the survival of the patients seems to be much worse with people with kidney transplants. So, I mean, we have to say that, and, you know, that, given that, please be careful. Please don't use that possible, you know, explanation for having a less severe infection. Well, actually, the data seems to show just the opposite, that we seem to see more severe infection, more ventilator dependence, more lack of survival in people who have kidney transplants who get hospitalized with COVID-19. So please don't use that as a reason to open up or to be lax about the precautions that we mentioned today.
Thank you for that. So another good question. So we've talked about dialysis patients, we've talked about transplant recipients. What about people who are maybe earlier in their chronic kidney disease? Maybe they're stage 3, stage 4. What does their risk look like? Are they at the same elevated risk as dialysis patients and transplant recipients? What advice would you give to those patients?
Well, I would say that, you know, the social distancing applies to them just like it applies to everybody else. We don't have data on outcomes for like CKD stages 3, 4. You know, I haven't seen anything on that shows us outcomes relative to people who don't have kidney disease. You know, I think the transplant issue is, you know, you're taking medications that suppress your body's ability to fight an infection. And in stage 4 kidney disease, you know, you're not taking those types of medications. But we do know the immune system is related to kidney function, so that as you lose kidney function, your immune system gets weaker and weaker. So I would say if you have advanced kidney disease, you know, think of yourself as being at higher risk, although I don't have data to support that. Maybe Dr. Vassalotti knows some data that I'm not aware of.
Yeah, I agree. And I would just say that, of course, if you have emphysema and you have CKD stage 3, or if you're overweight, if you're 72 and you have CKD stage 3, those other factors are going to drive your increased risk. And that acute kidney injury or sudden loss of kidney function is a major complication of COVID-19. And we're seeing rates something on the order of 3 to 20% in hospitalized patients, and even higher than 20% in hospitalized patients who are in the intensive care unit or treated with a ventilator. In the United States, at least. In other countries, the data seems different. So the risk of acute kidney injury is going to be amplified if you have decreased kidney function to start with. So you're going to have much higher risk. So certainly, you know, whether it increased risk for contracting the virus, I don't think we know that, but I think you're definitely at increased risk for more severe COVID-19 based on what we know so far and based on what your unique comorbidities or other medical problems are.
That's very, very helpful. I think those are scary but important numbers to hear about acute kidney injury and those high rates. I know that's something that a lot of people have been hearing about and are concerned about. Another question from Richard on the webinar. He's a kidney transplant recipient in upstate New York, and his regular blood tests were postponed about 6 weeks ago, and he's just wondering when it's safe to resume going in for blood work and routine lab tests and things like that.
Okay. So upstate New York, I guess I'll take that. We're proud of our governor, Andrew Cuomo, for all he's done here. And I have to tease Holly to say, you know, Chicago is the second city for a reason, right? And nobody is going to ask me what the first city is, because we all know what the first city is in the United States. And it's kind of redundant. But as far as getting back to upstate New York, you know, when are you ready to do the testing? I think you have to work with your local clinicians and, you know, ask about the possibilities. Does it mean you have to come in for a face-to-face test, face-to-face visit to do a test? Are there other ways? Can you, depending on your health insurance, can you have home testing done where the phlebotomist comes to your home to draw the blood and collect the urine that limits your exposure? Can you go to an outside laboratory? The major laboratories have, upstate New York probably have multiple sites that are close to your home. Can you go to one of those and call the outside laboratory in advance, call them on the phone, make sure your lab tests have been ordered in the future electronically, make sure that you can set a time to go so you can go in and out as quickly as possible. If you're comfortable doing those are things that you can work out with your local clinician in upstate New York.
And also, there are companies that will do in-house testing for transplant recipients too, right?
Yes.
3 separate companies.
Yes, that's a good point. Thank you for mentioning that.
Yeah, I don't know if that's on the NKF. I don't think that's on the NKF website, but if you direct message me on Twitter, I can send you that information. Just look for Holly Kramer, and I can send you that information. But you can do in-house testing.
You can also contact our NKF Cares line if you have questions like that, and they would be able to help point you to those resources as well.
Yeah, yeah, and I think the other thing is that, I mean, I've had patients that don't know that they can do a telehealth visit, you know, and I don't think, you know, like a telephone call isn't going to have a copay. So I think, you know, just contact your providers and make sure that you're maintaining contact with your providers, even if you feel okay, just to, you know, they will like hearing from you. I mean, I really like hearing from my patients, especially during this time. So I think just make sure you're maintaining contact with your care providers.
That's great. Yeah, that's a good point that you can have a telehealth visit by video or by telephone. So it's a really good point.
Yeah, that's great. Another good question. What about either kidney patients or dialysis patients or transplant recipients that have children that are in daycare or in school? Should they be sending their kids back to daycare right now? You know, how do you deal with having children that might be, you know, not getting the infection, but maybe spreading it?
You want to take this?
Yeah, I've heard this question, and I think it's really difficult to answer. I think because children may be exposed and children may have the virus without symptoms. So I think that you have to take that seriously. So, you know, how do you work that out? You know, do you delay having your child return to school? Do you try to make other arrangements? You know, I think this is a really tough question that you know, you have to work through individually. I think it's really important not to just work with your school, but work with your clinician. So ask your clinician and explain this situation and see if they can help you navigate that, and what kind of things can you do to protect yourself in that setting, knowing that it's almost impossible to protect yourself from your child. So, you know, completely. So, you know, what are the kinds of things you can do? And I think these are difficult questions, to be honest, that we're being asked now. and especially for patients who are immunosuppressed or transplant recipients.
Yeah, thank you. Here's an interesting question from Matthew. He said he heard the virus can live in water. He drinks tap water, and now he's concerned if that's safe to drink. Is there any data on that? Anything to support that there should be a concern with drinking tap water?
I drink tap water, so I have never heard that that's a problem, and I wouldn't think that does. To me, that doesn't make sense. It's usually you obtain it by like either touching the virus and putting it in your nose or your eyes, I guess, or inhaling it. I just think it would be unusual for it to be in water and that you would get it that way. I've never heard that.
All right, well, good myth busting there, I think. Here's another good question from this person, didn't give their name, but they're asking about in-home dialysis and if that is becoming more common and what might be the advantages or hurdles for someone considering in-home dialysis.
Well, I think that this is a time that home dialysis has some advantages, because I think it's easier to home shelter. It's easier to implement some of the precautions we talked about today if you're on home dialysis, whether it's home hemodialysis or peritoneal dialysis, either one of those. So I think home dialysis is a patient-centric therapy. It's something we should be offering to probably more patients than currently are treated that way in the whole country. And I think certainly there are some policy changes that have occurred that the National Kidney Foundation has worked on through advocacy to help increase access to home dialysis in general with the Advancing American Kidney Health Initiative, but also in this time of the COVID-19 pandemic to help increase access to home dialysis. So certainly whether home dialysis is right for you or not is something you should work out with your clinicians, but I think in general, it's definitely something you should consider, definitely something you should ask and work through with your clinicians about. And I think there are added bonuses of or added protections, let's say, of home dialysis at this time.
Thank you. Dr. Kramer, another question that we have from Michael is, what advice would you give to transplant recipients who maybe have travel plans outside of the U.S. In early summer? Specifically, this person is going to the Caribbean.
I would not do it. I would cancel and get your money back. I would definitely not travel, especially outside the U.S.
Yeah.
Period. Yeah.
Mm-hmm. Thank you.
Yeah.
Another good question. So we've acknowledged that there, or it's pretty commonly known now that there are disproportionate rates of African-American deaths attributed to COVID-19, along with higher rates of kidney disease in the African-American population. Are there additional strategies or protections that African-Americans with kidney transplants or kidney disease should take to protect themselves?
You're on mute.
Technical difficulties.
That's a great question. I hope you can hear me now. I think that you should just be extra careful. I think I've seen there was an editorial in the New England Journal of Medicine and one in Annals of Internal Medicine in the last few days that addressed this. The National Kidney Foundation wants to erase these disparities, of course, and we're going to be having some Facebook Lives coming up that will talk about this for both Hispanic patients and for African-American patients. So that may be helpful for you to listen to. I think that we're going to have to focus on the root causes of that in general as a society, and try to overcome them with things like the vaccine. Maybe that we should prioritize populations that were at increased risk, for example. But as individually, what you should do, I think all of the things that we talked about today, you should be extra careful. I don't know if there's anything specific that's different for you. I would say, the 90-day supply of medications comes into play sometimes. Understanding your medications, I'm just going to get into a little more detail. What does each medication do? Why am I taking those medicines? What is the goal of those? I think really trying to take your engagement of your healthcare to a higher level, so you understand what medications you're taking, why you're taking them, what the goals are. Work with your clinician to help you understand, and talk with your clinician about your concerns about the risk of COVID-19 for you as an individual, and what you can do, or what are there other extra steps you can do. And I would say it's an excellent time to think about, if I have diabetes or hypertension or high blood pressure, are those controlled right now? Talk with your clinician about that. Make sure those are controlled. Are there things I can do for my kidney disease to control it? Am I on the right diet? Do I have access to healthy food? Am I living in a food desert or a food swamp where I can't get fruits and vegetables easily? How do I overcome that? Maybe you need a dietitian to help you. So I am just giving you some sense of some aspects that might be helpful to you as an individual. And I think you working through with your healthcare team will help you decide which of those are really apply to you.
Thank you. Diane asks what she can do to bolster her immune system or boost up her immune system to protect herself. Are there any other things that you haven't mentioned?
So there is some evidence that getting sunshine increases your immune system. So we know, like back in the 1920s and 1930s and 40s, when we had the tuberculosis epidemic, a lot of people traveled to Colorado and sat outside in these spas, and that many people recovered. And we think that some of that just has to do with that the sun increases vitamin D, which can help with some immunity. But maybe there might be also other immunity that gets improved with sun exposure. And we also think that there might be less transmission of the virus in areas that have a lot of sun exposure. So I think getting outside is good. Physical activity, I think, also increases your immune system. And as you would know, eating fruits and vegetables, eating healthy foods and not eating processed foods also increases your immunity. And I know that there's like recipes that include basically like a lot of berries and green vegetables to increase your immunity. But I think just eating healthy, eating like real food, fruits and vegetables, things that have fiber in it, can help you as well. And then I also think stress suppresses your immune system. So when you feel yourself just really stressed out, stop whatever you're doing and take really big, deep breaths in slowly to try to suppress all of that stress and get your body breathing again. And that'll help with your immunity as well. So stay in the present to try to not think about the future is what I'm trying to do to lower my own stress levels. I think I'm just as stressed as everybody else. And I really try to just stop whatever I'm doing when I feel like I'm holding my breath because I'm so stressed out, to just take several slow, deep breaths. I don't know if Dr. Vassalotti has any other tips, might have some good like Italian recipes for your immune system.
Wow, okay, so I think what you said is fantastic. And I would just say one other thing is that sleep, I think, is important to the immune system and to our health. So most of us need about 7 hours of sleep, but give or take, and we all have, there's some individuality about that, but try to make sure you're getting enough sleep. And then I want to thank Dr. Kramer for giving me a pass on the jab I took at her with Chicago. So thank you. And I would say one other thing though. Dr. Kramer elegantly reviewed the elements of health and the elements to maintain a strong immune system. Please don't go on the website and don't buy some magical pill that you think is going to cure you, or you think is going to give you, boost your immunity boosting medicines that are probably mostly delivered by charlatans who are just trying to make a profit, and probably will not help you and will only reduce your finances. So please don't get involved. And there's probably going to be an outbreak of those kinds of cures now, or those kinds of promises now. So I think the elements of health were really great description from Dr. Kramer. And please don't look for a magic, bullet or pill, I should say.
Thank you. Yeah, I appreciate all of the things you said. I think that they're right on, and definitely emphasizing there's no magic supplement that's going to protect you from this or really any illness. It's just the basic things like eating healthy and getting exercise. Well, we are just about out of time, and I know there's a lot of questions we haven't gotten to, but I also know that you two are very busy medical professionals, and I don't want to keep you from that. The only question I see that I think would be worth touching on, and I know you kind of touched on this in the beginning, but what about immunity from the virus if someone got exposed, or maybe someone wanting to get an antibody test to find out if they have immunity so they can go back to living their normal life? What is the evidence that there's immunity from having gotten the virus before? And, are those antibody tests effective in determining that immunity?
I'll let you take this again.
Okay, fine. So I would just say that I think it's interesting, and it's probably good to get antibody testing if your doctor offers it and you have availability to it. It might be informative, but I think we have to be very, very careful because we don't know what that antibody, if you have it, I wouldn't walk around and stop wearing a mask, and I wouldn't stop washing your hands and do all the things that we've talked about today. It might just be information that helps you moving forward as we understand it better. We don't know if we think that antibody should be protective, but we don't know. We don't know what level of the antibody is protective. Some places are using patients with high antibody titers to deliver convalescent serum. So that's taking antibodies from multiple individuals who've recovered from the virus and using that as a treatment for patients with severe COVID-19. Now, there are trials that are going on, so we'll have answers to whether or not this works or not, which we don't have yet. So as time marches on and the antibody tests become better and we understand them better and we understand the meaning of the level, so it's not just whether you have the antibody or not, it's how much of the antibody you have, how much is protective, how much is required for convalescent serum and so forth. I think as we get all of those answers, it will be more important. And as we move forward, I think the testing is going to have a greater role, the antibody testing, in addition to the nasopharyngeal testing for the acute. And so with acute infection, you need the nasopharyngeal infection, the nasopharyngeal test, the swab. For a recovery or previous infection, you need the antibody test is what will evaluate that. But the FDA and the CDC are working through this now. So hopefully, this is May 7th, we'll have a better answer in the future.
Thank you for that. I know that there's a lot of tough questions that we just don't have the answers to right now, and I appreciate you doing your best to give us where the knowledge is at right now, because I think that's really helpful. So do you guys have anything else you'd like to add before we wrap up, either of you?
I would just say you have to be your own advocate is what I'm seeing. Really advocate for your health.
Oh, I think you're muted again.
No, I want to thank you, and I want to thank Dr. Kramer. It was great. It was fun working with you, especially when I can say what I want and you don't come back at me about Chicago. But seriously, I think I'm just using humor, and I hope that no one is offended by that, but it's one way of coping with difficult times. I want to thank you all for being part of this, and also thank you for what you do to protect yourself is also protecting your community. You're protecting others too. So we're in this together. We look forward to ongoing engagement, and thank you.
Yeah, thank you both so much for giving your time to us today and for sharing your knowledge. To everyone who submitted a question that we did not get a chance to answer, and I know there's quite a few of you, we will answer them directly in the comments on Facebook or by sending you an email to your webinar comment or questions after this event. So thank you guys, and I hope to see you on our next Facebook Live.
Stay safe, everyone.
Yeah, thank you.
Thank you.